You will perform a sit-to-stand transfer to assist the patient to a standing position to utilize the walker. The patient will first need to be positioned on the edge of the bed with their feet flat on the floor. Begin by applying the gait belt. Proper gait belt application can be viewed in a separate video. With the patient facing the edge of the bed, with feet dangling, instruct the patient to push through the bed and scoot forward until their feet reach the floor. If they have trouble pushing against the bed, but would rather hold the side rails, put both side rails up, in a position to leave the gap in the center of the bed, and allow the patient to pull themselves towards the edge of the bed until their feet touch the floor. If the patient requires more assistance in reaching the edge of the bed, you can assist by grasping the gait belt and helping the patient scoot forward. Anytime you assist a patient to position themselves, make sure you first position yourself with a wide base of support, and lift or pull from your legs, not your arms and back. With the patient sitting at the edge of the bed, look at the angle of their knees. Standing from a seated position is easier when the knees are at 90 degrees or greater. For taller patients, you may need to raise the level of the bed until the knees are bent at or slightly beyond 90 degrees. With your patient at the edge of the bed, make sure their feet are resting completely on the floor, shoulder width apart. Always stand to one side of the patient, never directly in front of them. Bring the walker into position in front of the patient, with the patient centered behind it. The next step is for the patient to stand. Begin by having the patient lean forward into a nose over toes position. Then put your foot directly in front of the patient's nearest foot, to prevent any sliding of their foot while they stand. With one hand, hold the walker in place to prevent it from potentially sliding or moving while the patient gains their balance. With the other hand, grasp the gait belt from behind the patient and instruct them to either push up from the bed or from the side rails. Aid the patient from the gait belt, again, standing with a wide base of support and supporting the patient with strength from your lower body, not primarily your arms and back. Once the patient is standing, they should grab the handles of the walker, have them stand up and gain their balance. If the walker is appropriately sized, they should have a slight bend in their elbows when standing up fully. The patient is now ready to ambulate with the walker.